In this video, I'll walk you through major steps of the cardiac cycle. This is a cycle, so it doesn't matter in which phase you start, you will get back to that phase. I would like to start with a phase that is called ventricular filling. The name tells me during this phase, ventricles are receiving blood from the atria. During this phase, due to higher pressure in atria versus lower pressure in ventricles, AV valves open. So as you see in both sides, inside the atria we have higher pressure and inside the ventricles we have lower pressures. So in the right side, tricuspid valve opens, and simultaneously in the left side, bicuspid valve opens, and then blood flows from high pressure in atria into the low pressure in the ventricles. Note that at this point the entire heart is relaxed, none of the chambers contract. Most volume of blood that ventricles receive from atria would be during ventricular filling. However, at the end of ventricular filling, we notice that atrial walls contract. As soon as atrial walls contract, we switch to a phase that is called atrial systole. Systole refers to the contraction in the wall of the chamber, and clearly atrial walls are contracting. Atrial walls contract in an attempt to add a very small volume of blood to the blood that we already have inside the ventricles. So again, most of the blood that ventricles receive would be during the previous phase, ventricular filling, and here we're just adding a very small volume of blood. However, note that during ventricular filling, all four chambers, including atria, are relaxed, but during atrial systole, atrial walls contract. Atrial walls relax in the next phase, and ventricular walls start contracting. As soon as ventricular walls contract, we notice inside the ventricles, blood is pushed up. So there is a risk that blood from ventricles go back into the atria. Clearly, AV valves quickly close to prevent backflow of blood from ventricles into the atria. So here, AV valves are closed and we have not opened semilunar valves. That's the reason ventricles are not receiving blood and they are not sending blood out. Basically, the volume of blood that we have inside the ventricles does not change because all four valves are closed. And that's exactly the name of this phase. The volume of blood does not change inside the ventricles because all four valves are closed while ventricles are contracting. The name of this phase is isovolumetric contraction. Contraction of the ventricles become more forceful and applied fresh pressure on the semilunar valves, and we see in the next phase semilunar valves open, and this is the moment that ventricles actually pump blood out. We see that right ventricle pumps deoxygenated blood into pulmonary trunk. Left ventricle pumps oxygenated blood into aorta. So since ventricles are ejecting blood out, we name this phase ventricular ejection. As soon as ventricles relax, blood inside aorta and pulmonary trunk start backflowing toward the ventricles because ventricles are no longer pushing blood into these arteries. Clearly, this is the moment that semilunar valves quickly close to prevent backflow of blood from arteries into the ventricles. So here we have closed semilunar valves and AV valves are not open yet. So this is another isovolumetric phase. The volume of blood that we have inside the ventricles does not change because all four valves are closed, but please note, during this phase, ventricles are relaxed. So this is a phase that we call it isovolumetric relaxation. And we notice that right after isovolumetric relaxation, we get back to the point of time that the pressure inside the atria would be higher than pressure inside the ventricles, and that leads to the opening of AV valves and the start of ventricular filling. There are similarities and differences between these phases. In 5 separate videos, I discuss each one of these phases individually if you are interested to learn about them.